Hello, this is Joan Justice of HealthWorks Collective, and I'm here today with David Wong, a practicing emergency department physician and founder and CEO of SnapHealth. David, tell us how and why you started SnapHealth.
Sure. So, as an ER physician, we saw a lot of patients coming to the ER who were actually paying their bills and they didn't have emergencies and they knew they didn't have an emergency. So, I actually asked my patients, "What is it that brought you here?" And they were like, "Well, I don't have insurance, so where else can I go?" So there was an obvious knowledge disconnect where they clearly did not know they could just try and pay cash at a doctor's office. And when you actually try and do that and call doctor to doctor, it's actually a very slow and kind of haphazard process, and it's actually difficult to get the information of what the cash prices for doctor's visits are.
Right.
So we thought this is a good solution that a problem that can be easily solved with a web-based solution in the 21st century, and to solve that knowledge disconnect problem. But it really goes to a bigger problem, which is the whole healthcare reform debate went on and closed without any discussion of what things actually really cost. And it's really hard to say how healthcare costs are going to be bent when the two big players, the patient and the doctor, have no idea what anything costs. If you were to ask the patient right now what a CAT scan would cost of their abdomen, they would have no idea. And sadly, if you ask the doctor ordering that same test, they would probably have no idea either.
Right.
So when the two major players in the healthcare ecosystem are completely oblivious to cost, we don't really see how it's realistic to bend the cost curve. So we tried to put that information completely transparent on our site and give it sort of an Amazon for healthcare feel.
Mm-hmm.
So exactly what you're going to buy and exactly what you're going to get, and you can sort of cost compare and also look at quality reviews and make an informed decision.
Yeah, it sounds like a really wonderful idea. What about the doctors, though? Why do they join up with SnapHealth?
Sure. So part of it is lead generation. They want to see more patients. The other is that, quite frankly, a lot of physicians they're sick of the current process. They spend a lot of time filling out charts and paperwork just to focus on reimbursement. The typical physician practice pays a billing company 8% just to get paid back by health insurance.
Mm-hmm.
They're always facing declining reimbursements by either Medicare or commercial insurance. And then on top of that, it takes 60 to 120 days just to get paid for your care. So there's a pretty big accounts receivable there. Whereas our platform is the completely cash, credit card, transparent,
Yeah.
efficient pricing, so that by the time the doctor has seen the patient, they're paid within a matter of a couple of days with absolutely no paperwork. They get an email that just says verify you took care of Mr. Smith a couple of days ago, and that's it.
No paperwork. That's a
No
big plus.
paperwork.
And do you have a typical patient profile? Are they mainly younger patients or older patients or everything in between?
Actually, surprisingly, we don't have a typical patient profile. I think it is a little bit of everything. The younger patients tend to go for more simple issues. Older patients, some of them are priced out of insurance because they have pre-existing conditions. So insurance right now is unaffordable to them, so they can get care at affordable prices because they've been quoted prices like $800 to $1,000 a month for health insurance because they have a pre-existing lung disease or something like that, or if they've had cancer before. Um, but no, there's not really a typical profile. I can't say there is.
Okay. And what's been the reaction so far from the
So
patients or?
far, the patients really like it. The ones who have gone through say that's amazingly easy to use. We spent a lot of time making sure that we really made a great customer experience, because that's sort of what we think is missing from healthcare, is this really like, wow, that was so much easier than I thought it could be.
Right.
So from the point of first contact when they're shopping, just like on Amazon, and then they buy, and then it goes straight to their Google Calendar. They get a reminder the minute the reminder pops up. It goes straight to Google Maps and starts giving them directions to the doctor's office. And likewise, there's no bill stream afterwards. So there are no bills that they get for weeks and months afterwards that typically you would get from a doctor's office. They've already paid, so it's all done.
I know
So
the absence of paperwork must be great. All right. Well, thank you so much, David. SnapHealth is certainly a huge step forward in this consumer-driven healthcare, and the cost transparency is just what we need. And I think it'll do a lot to reduce costs in healthcare and maintain or heighten patient satisfaction. I think it's a great idea.
thank you.
Thank you.